in previous years, we haven't spent much time during our program talking about regulation and what's going on Capitol Hill. This year is different. Not only were we lucky enough to welcome two amazing representatives from the FDA, one of which is coming up next, I think, or after, but stepping onto the stage is an inspiring entrepreneur who has been one of digital health's greatest advocates in our government. Leading this discussion is Dr. Nick. Please give them both a warm welcome.
Bienvenue ce matin avec Bettina. Oh, ce n'est pas en français, oui? No.
Not quite. I think I became American 30 years ago. So
I teased her a little bit. I was going to introduce her in French. And I'm delighted to welcome Dr. Bettina Experton. She is a long-standing member of the community, has done so much, in fact, has such enormous history that if you don't spend at least 30 minutes listening to all of the background and the story and the path to the innovation that she has led in this space, I would encourage you to try and find some time to do so, because you're missing out on some of the key aspects of what allowed us to get to this point. Interesting fact today, how many knew that it was 10 years since Meaningful Health was launched? Meaningful Use was launched. I can't see anybody, so I've got no idea I'm not going to ask another question now. I can't see anything out there. So as we think back to the last 10 years, we've got some exciting opportunities, and specifically with some of the legislation that's coming out. Bettina, could you tell us a little bit about what's going on at CMS and what they've done?
And then one word about Nick. I think you need to spend more than 30 minutes going over what Nick has achieved and Dr. Nick has achieved.
Thank you.
So I think we are coming at an exciting time.
I agree.
10 years behind us, so it was on December 30th when Meaningful Use were published by CMS. And at the time, in fact, in 2009, only 14% of hospitals had digitalized their medical record. By the end of Meaningful Use, so we are at 90+%, but the information doesn't flow. It's about information blocking. So Congress, in a bipartisan way, passed the 21st Century Act and told CMS NHS to find means to resolve that information blocking. And at the end of this month, I think it's transformative. Finally, the end goal of Meaningful Use, or even when the ONC was created under Bush in 2004, to have every patient, every American, have with them their longitudinal medical history, may come to be with those finally published rules to fix the lack of interoperability. So this is CMS, which, again, by the end of the month, is going to publish those patient access and interoperability rules, mandating every plan doing business with CMS, which is Medicare Advantage plan, Medicaid, managed care plan, and CHIP, plans in the CHIP program, will have to have open, standardized API for the patient to access at no cost to them. For free. With the application of choice. No silos for the patient. And so that's on the CMS side.
And that's coming this month.
It's coming this month, published rule. I know industry, I'm talking about the provider industry, has been resisting, and payers don't have the means to adjust technology, but no, it's happening. There's no way about it. Consumerism drives it, AI drives it, and on the provider side, same thing. The providers will have, under the ONC interoperability rules, so HHS under the 21st Century Act was asked to put in place the fix for this lack of interoperability, and providers through their EMR will have to use standardized API, same thing, for the patient at no cost, to access with their smartphone application of choice their data, so they can be assembled in one place in their hands. And this is a common sense approach which has been 10 years in the making.
It's the question we're probably all asking, why that didn't happen 10 years ago, and I know David Blumenthal has talked about that a little bit. So fantastic news, that's great.
Yes.
I think the VA has really sort of helped drive this, in part because they have this national system. What's going on at the VA?
So the VA, along with CMS and the military, we are behind this transformative Blue Button initiative. And the Blue Button has come to be that standardized access point. So CMS initiated that in 2018. Our application, iBlue Button, who won multiple ONC awards, needed to scale, thanks to CMS, to open that data with a standardized API, and the VA is doing the same. So the VA has now a API, the health API, for those applications approved by the VA, and our iBlue Button app is one of those three.
Only one of three, and that's Humetrics, right?
Yes, and a small other company called Apple is doing it, but that's only for iOS Apple device users. Humetrics technology, iBlue Button, serve two-thirds of veterans who are using Android phones and Apple phone, and add this layer of information beyond displaying the records.
Hey, and I think Congress is now going to build on that to add additional legislation, which you've been involved in, right?
Yeah, so that's an exciting opportunity you have. If we are members of the CTA who organize this extraordinary show, CES. And as a member of the CTA, if you are in digital health and you are not yet a member, you have to join. Because CES is a place where you can intersect with policymakers. And I got a call one time to testify before Congress, before the ANC, where Zuckerberg one day was asked to testify about privacy issues for Facebook. But the hearing was about disruptive technology. Can mobile technology change things in healthcare? And I truly believe that. And I as a physician, turned entrepreneur 20 plus years ago, I guess I was convincing enough in my testimony that one member of Congress came to me and says, what you say made sense. Can you help me draft a bill? And this bill is called the Mobile Health Record Act. It's progressing through Congress. And what it says, it's a government for those programs which you touch close to 200 million Americans with, Medicare, Medicaid, veterans, but Medicare and Medicaid, tells them about those applications you have approved to access those open APIs, those Blue Button API. Because everything has to scale if you want to make a difference in every single American's life, and if you want to make a difference at the population scale, and if you want to address cost in a meaningful way. So yes, watch out what Congress will do with it.
And if that wasn't enough, you've also been helping the NHS, and some of you might be confused by the accent, but obviously I've got some heritage in England, if you pick up a little bit of an accent there. You've actually got engaged with the NHS and have two, I believe, apps that are being prescribed in a digital format in one of the largest systems covering 40 million patients, right?
So when you were an A&E, emergency care physician in the NHS, at the beginning of your career, Nick, so one of the critical things when you access in urgent care, emergency care, A&E in the UK, is that time is of the essence to find out what medications are you on. My mom is on blood thinner. If she bleeds, people have to know that, right? And in the UK, they have a centralized record system, and they can log in, a physician or a nurse can log in and go to the summary care record. They don't have time to log in. They don't have time to search. And it's centralized. What if the patient come with that critical information in their hands? The application called SOS QR, it's now e-prescribed by 60% of GPs, general practitioners, to 40 million patients. Or those 40 million patients who can make use of those, not all of them. So transformative technology.
And to be clear, in this short period of time, I just want to cram in one other piece, and this for me is very exciting. With the FTC. So you've engaged with the FTC, and you have specifically a focus on patient privacy and the protection of the patient record.
So, as a physician turned entrepreneur and data scientist, it makes sense not only to have patients have their critical information, but for them to have control over that data. And also to have that data at their fingertips anytime. You may not have internet access when you are in this emergency room or in the physician's office. So you cannot log in and download that data, create an account online. So the data has to be on your mobile device. So we compute on the edge. Our algorithm may be updated in the cloud, but identifiable personal information is only stored on your device. It's called on-device AI also, because we compute and do fancy things on that smart computer, which is a smartphone or a smartwatch. And again, as a CTA member, I had the privilege to work on CTA privacy guidelines for the companies. So
and to be clear, they came to Bettina. They came to you.
Well, we first, as a CTA member, volunteered with a few other companies to draft those CTA privacy guidelines. And the FTC is going to take a bigger role in modernizing privacy rules, which are a little dispersed among states. And we had the privilege yesterday to get the visit of the FTC commissioner and Commissioner Simmons. And that's incredible. That's what CS can do for you. The opportunity to interact with regulator, policymaker. And he came to us and he wanted to learn more about our privacy by design architecture solution, but also get the experience of a smaller, middle-sized company, not a tech giant, who had innovated in the field and wanted to make sure that new regulation will not create barrier to innovation or competition. So we had a chance to share with Chairman Simmons what has been our experience.
I just want to ask everybody to give Bettina a round of applause for both the coverage and all of her advocacy that is just revolutionizing our space in the name of patients and clinicians. Thank you very much.
Thank you,